So we've marked off the hairline design, we've measured it, we go off the eyebrows to make sure it's symmetrical, but also uneven, because we don't want a regular fishbowl-like hairline. And then what we do is we're actually following the angles of his existing hair. So as you can see, his hair's blowing this way and the angles around here. So we don't want to make incisions that sit at 90 degrees, because then the hair will grow like a porcupine. So you want to make the incisions very flat, perpendicular to his existing hair. And obviously the front is very, very important. We're using a very fine blade for the front, and we're going to dense pack it. So as we score the area, as you can see, there's not a lot of bleeding that you'd expect. And that's because we've prepared the area with the tumescent anesthesia. Preparation is always key. Keeping the blade nice and flat. And then, once you've made your boundary, then you're stretching the skin and really making the area nice and dense. The patient is completely pain-free because we performed a frontal block. Particularly targeting the supraorbital nerve and supratrochlear nerve, which supplies the majority of the innervation to the frontal scalp. And this means that we can use a very small amount of anesthesia to anesthetize a large area. And we're going to continue here, and then we'll check back with you guys in a short while, and we'll show you what it looks like when it's densely packed.